My name is Dr. Barry Douglas. I'm a plastic surgeon at the Long Island Plastic Surgical Group. I'm a partner there. I have been at the practice for 23 years. My practice is fundamentally cosmetic surgery and surgery for breast reconstruction after patients that have had mastectomy or lumpectomy defects. Well, I've been art my whole life. I mean, that's basically my persona, even as early as I can remember, having a crayon bolted to my hands and just starting to draw. And it's been like that my whole life. And it's been a serious form of study. I pursued it through college, where I was a formal art major, and have done art my whole life, up to the point where I do the covers for the Northeastern Plastic Surgical Meeting, which I've been doing that for the last 10 years. The art is interesting because it gives you a certain 2- and 3-dimensional intuition that is part of you. I think it's bred into your own DNA. You can't learn it, it's there. And I think it really is helpful when you bring that over to patient care, when the conception of a planned operation is set forth, and you can really call on that skill that's really a part of you. It's like woven into your entire fabric. No 2 days are the same. Every patient, even if you're doing a similar type of procedure, the variabilities of a patient's physiology and the way they're just built makes it all different. And everything is an artistic challenge, and that's very exciting. All the breast reconstruction cases are very exciting because you are bringing back that which was taken away from a disease process. And to see a patient really feel female again, it's wonderful. And seeing what was possible surgically with the artistry involved in the reconstruction, seeing how they can feel whole again. And the techniques now are just wonderful in terms of providing exactly that. One case in particular that involved a severe trauma where a lady essentially severed her left arm above the elbow in a car accident, and she was a pianist. And being a piano and organ player myself, the thought of a piano player not ever touching that instrument again was very, very difficult. Over a course of 2 surgeries, we were able to reconstruct her arm by basically sewing it back on. And miraculously, the only 3 little sinews that were holding this arm together were her median, radian, and ulnar nerves. Everything else was completely severed. So under the microscope, putting everything together, she woke up the next day and was able to grasp our hand. And a month later, in a press conference, she actually played a piece by Beethoven on a piano. That was pretty awesome.